we can still do rigorous, well-controlled, maintained science regardless of our funding source. So it's a message we need to get out there. In the truth and the science sort of prevails will be an important day for all of us, for science, especially our patients who really could use other opportunities and other options. Our medications have failed them. Like we have failed our patients as a field. And that's, I think, the story about treatment resistance that's important.
An innovative, first of its kind inpatient study of ketogenic therapy for schizophrenia gets shut down by the Maryland Health Board. Let's hear from Deanna Kelly, who was running this study, about the importance of the study, why it was shut down, and the unfortunate impact this is going to have on patients. Welcome to Metabolic Mind, a nonprofit initiative of Bazooki Group, transforming the study and treatment of mental disorders by exploring the connection between metabolism and brain health. Thank you for joining us on this journey. Deanna Kelly is a doctor of pharmacy and a professor of psychiatry at the University of Maryland School of Medicine, and she was leading an innovative inpatient psychiatry research study looking at ketogenic therapy as a treatment for schizophrenia. But this study was abruptly halted by the Maryland Department of Health for no real apparent reason, as all privately funded inpatient psychiatry research studies were suddenly halted. So we're going to hear from Deanna about this, but before we do, I want to point out that in the description, we have a link to a petition circulated by Dr. Christopher Palmer at change.org. So please take a look at that petition. And if you feel you agree with it, please take the time to sign it, as it'll help privately funded research and it'll hopefully help the Maryland Department of Health see the potential error in their ways. We also link to the Baltimore Sun article, which broke this news. So take a look at those. But here's the interview with Deanna Kelly. Dr. Kelly, welcome to Metabolic Mind. Thanks for joining me today.
Oh, my pleasure to be here. Thank you.
Well, I was excited to have you on to talk about this study that you're doing, this really impressive study that you were designing for ketogenic therapy treating schizophrenia. But unfortunately, because of recent events, we also now have to talk about why that study isn't happening and why you were basically told to shut it down. But before we get to that, why don't you tell us about the study, what it is, what inspired you to do it, why it's so important, and then we'll get into more of the nitty-gritty after that.
Sure. So there's a lot of background here. I've been working in the field of schizophrenia research and caring for people with schizophrenia for most of my life. So it's been about 26, 27 years. We have been in search of new treatments and new strategies to improve care for our patients. So I'm a clinician, I'm a treatment researcher, and I've been working at the Maryland Psychiatric Research Center in conjunction with Spring Grove Hospital Center for my entire career. We've had a joint research mission and a joint research program to help improve lives of all the people we treat. So we have had a long history of conducting clinical trials. And so pharmacologically, we've looked at lots of strategies. And unfortunately, a lot of the antipsychotics that we have today and still don't work for everyone, have lots of side effects associated with them, are not ideal. Some of them are expensive, some of them have long-term side effects. And we've been searching for better treatments. And about a decade, maybe 15 years ago, I got involved with sort of like other strategies than pharmacologic. My background is in pharmacy, but the science actually took us in another direction. And we originally started to look at what are some of the underlying pathophysiology or underlying mechanisms of why people have their illness. And we had found some things like on the metabolic side as well as the immune side of the story. So it might not be just a story about blocking dopamine receptors with our antipsychotics that we have. It's a bigger picture than that. So I got into looking at gluten-free diets, and particularly in those who have antibodies and have an immune response to gluten. And that's a whole nother story for another day. But that kind of led me down this road. And finally, I came across this field of metabolic psychiatry. And I really, after reading the works of Dr. Chris Palmer and many others I'm leaving out in the field, and seeing some of the research and case reports, it was pretty profound because I've seen people do well with some novel treatments that outside of the regular schizophrenia antipsychotics, and had a lot of hope here. And so that's really started us like understanding like what might be going wrong. And we could talk a little bit more about that, but that led us down the road of looking at a ketogenic diet study. And so what's exciting is for us is that we have this joint inpatient program at, in collaboration that I was mentioning. And it allows people to participate in our hospital system in an inpatient study. And this study that we were conducting was the only inpatient study that we were aware of to our knowledge. I think that we've confirmed that in the United States. And why that's important, there's lots of reasons why it's important, because it gives us a chance for the first time to really look at the most controlled environment that we could get to see if this the therapy could really be effective. What they're doing a gold standard clinical trial is important. The case studies or the open label studies, these are all very important. But if we can do a single blind randomized study in the inpatient setting, where we control the environment, everyone has treated with the same sort of diet, everyone that's in has a similar exercise patterns, similar living arrangements, so that we can study other mechanisms like the gut microbiota, the bacteria, the composition. So we have a controlled environment to do that. But then we also at the same time are giving our inpatients a chance for something new. So our study is a single blind study. It lasts 5 weeks. People are either randomized. This is after they consent, after they have assessment to make sure they can sign informed consent. It's a rigorous processes. We go through all that. And if people are eligible for the study, they meet eligibility criteria, they're assigned to either 5 weeks of a ketogenic diet or a regular diet. And we'll be measuring, in this study, we were measuring psychiatric symptoms. We were measuring side effects. We were measuring the amount of ketosis they were in. We can talk about more about that in a few minutes, but all the things we were measuring. But we also were collecting stool samples from these patients as well. And then after the end of the 5-week period, everyone was allowed to opt in an open label phase for the ketogenic diet. So that means everybody that was in the study got a chance to try something better.
Oh, but that's just such wonderful background. I mean, it's true. We have to acknowledge that the treatment for schizophrenia, especially so-called treatment-resistant schizophrenia, is not good, right? And there's treating to make someone safe, and then there's treating to get someone back living their lives. And so that's why innovation is so important. So I really like how you phrase that, looking for something better, looking for something new. And like you said, there are different types of research. The so-called real world research, when someone's living their lives in an outpatient in their own home, taking care of their meals, that's important. But so is the very controlled inpatient setting, like you're saying. And this is very unique to have this opportunity for the inpatient setting. So it sounds like a fantastic trial, a really good setup that you could really learn a lot about ketogenic interventions for schizophrenia. So how many patients did you end up enrolling to this point?
Yeah, so we had 4 people enroll in the study before our study was shut down. You did mention about the controlled diet environment. So what we did with this study is you're exactly right on that, is that we worked with dietitians. So we had our hospital dietitian well trained, but we also had 2 consultant dietitians on our project, both from one was a dietitian, sorry, and one was neurologist who's been working in the epilepsy space. But we had a lot of input on how to design the diets, as well as the outside people. But we were looking at what's a 2.5 to 1 ratio, which means that we were looking at like 2.5 grams of fat to every gram of protein and carbohydrates, and trying to get people an easier framework with less sort of fat and an easier, like a little bit more carb, to get them into ketosis. If people couldn't reach ketosis, we upped that a little bit on the fat content to 3, but it was allowing us in the inpatient setting for taking that onus away from the patient and the family to have to do that, to try this out, to letting the dietitians and the experts do that for them, so that they had their diets applied for them, and they had three nice meals along with snacks. And if things changed at all, we could modify that to be welcoming to how their dietary, like if they had other special dietary concerns. So like everybody rallied around to create the best diet you can imagine. Like, wouldn't we all want that kind of like help to do it? But I'm glad you brought up that point. But yeah, we ran 4 people in the study. before it was shut down.
Yeah, so I mean, just hearing you talk about the thought process that went into this, it's clear a lot of work goes into these studies, right? You have to come up with the idea, you have to hash out the design from the generals down to the specifics. You got to have the team in order. You get the IRB approval. You get everything lined up. You start recruiting patients, and then what happened? All of a sudden, you're shut down. So tell us about that and how it's so unfortunate. But tell us, how and why you found out about this.
Yeah, no, unfortunately, it was the first week of March of this year. We are the Maryland Department of Health. We have a new administration and a new Maryland new behavioral health administration, unfamiliar with the long history of research. Decided to put a pause on the inpatient research studies at our research center, and we were very upset about this. And this was, of course, very bad news, but we wanted to make sure that, any policies that they were looking at, any procedures, everything was very safe. It has been 16 weeks since our shutdown. We did answer many questions, cooperated fully with the health department, and in fact, trying our very best to help them with all the information that they would need to make decisions on the studies that were in question, in the processes. So, as of last week, they had decided, after reviewing all the policies and updating, some of the procedures, et cetera, that the other inpatient studies that are federally funded could proceed, but not privately funded studies. And this was then a blow to us. Of course, really good news that the federally funded studies could move forward, but there was nothing found in terms of the way we conduct science, on safety, on efficacy, on research conduct. In fact, we have very rigorous institutional review board review. This study is under, or all studies are under, data safety monitoring boards that are separate from the IRB. There's a hospital research committee. So we have 3 committees right there that have to review everything that we do. All of our researchers have to be fully trained, experienced, have special training in human subjects protections. And we have a long history of conducting research in a very safe fashion. And like I mentioned, everybody gets benefit from this work. So it was really a blow that it was just privately funded studies. We really have no rationale around that decision about the separation between federally funded studies and privately funded studies. But unfortunately, clinical trials in our country, in the United States, are funded mostly by private foundations or private funding. And there was an article that came out in 2023. I think that the leaders of that article were from the Treatment Advocacy Center, Fuller Torrey, and others, and had done a review of what's happening with NIH-sponsored trials. How many clinical trials are being funded? And in that paper, and I think the Baltimore Sun article references that paper, but in that paper, the group that published at the time found one NIH-sponsored study in schizophrenia. And in fact, that's our other federally funded study that we have going on. So the only one that they found and published on at the time is the one study that we have. So that just shows us that in the field right now, clinical trials are funded by other means. And to get science done in our country, we rely on important foundations. I mean, there are major foundations out there. Bill and Melinda Gates. There are, the American Heart Association. These are just few examples of within different organizations, but or many organizations that fund research in all aspects of care, as you know, and everyone else knows. And we need them to fund our science to move forward. But unfortunately, this has been the decision, and we have no good rationale.
Yeah, I mean, that I find that so shocking, and I think it's really important to reiterate what you said, that there weren't safety concerns, there weren't complaints, there weren't really bad outcomes that showed neglect. Like, those make sense. You see those, and you question, and you maybe pause or shut down research. There was none of that, and yet somehow it's okay if it's federally funded, but not if it's private funded. And I know it wasn't your decision, so you can't say exactly why, but so frustrating that sounds like they didn't even explain it as to why the difference, which is horribly frustrating and just seems really unfair. And like you said, if there's one federally funded schizophrenia trial, and especially sort of innovative new techniques, like federal funds don't tend to go to those. You need to have like a proven track record, it seems like, before you get federal funds. So how are we going to do innovative research in the field of psychiatry and schizophrenia if they're shutting down private funded studies? So Is this like the end of the line and the end of the road, or are there things that maybe we can do, or people we can talk to, letters we can write, phone calls we can make to try and undo this, because it seems like such an injustice?
Yeah, no, I mean, I think that, I mean, education for the public and for our lawmakers and for anyone making decisions, like, I think it's really important for people to know, like, how rigorous research is in today's landscape. It's very rigorous. But it's also important to know, like, how are things funded and how do things work? And I think getting the word out there that our field relies on the private sector to help fund research. That doesn't mean there's a bias that's somehow different than NIH funding. NIH funding is incredibly important for the field of science. But if you read that article, you see that it's challenging to get clinical trials. And like, I'll give you an example of why that is. Um, the National Institutes of Mental Health, for example, requires when a clinical trial is going to move forward that you have to have a target of engagement or an underlying sort of mechanism identified to see it. And that has to link on to the outcomes of the study. And you can imagine, I mean, this is really simplistic, but if we had the cure for schizophrenia, but we didn't know how it connected to brain circuitry, we couldn't run the study. We couldn't get it funded because the way, I mean, it's rigorous how science has to go. I mean, this is no slam on our federal funding agencies. We have the incredibly important funding agencies that fund all of science, but I'm talking about the process of we have to understand the circuitry, we have to understand how it relates to the outcome, we have to show that these targets are movable and that relates to brain circuitry or to a process in the body, and then that has to link to the outcome. And researchers have to take several studies and lots of funds to get to that point. So it really slows down research for rigorous reasons, but slows down research where private foundations can fund studies where we have information like the ketogenic diet, where we think we know how it works, but we haven't linked all the brain circuitry to our outcomes yet in the field. We're almost there, but we have, there are some NIH funded studies already doing this. So we're getting there, and that's awesome. But that's how long it takes people to get NIH funding. You have to go through this process. So the private foundations have to step up, and this is not just in psychiatry, it's for all areas of science. And this is important for the world to know that, we can still do rigorous, well-controlled, maintained science regardless of our funding source. So it's a message we need to get out there. It's important.
Yeah, and that's so crucial, that just because the funding is different doesn't make the science any less rigorous, doesn't make the IRB approval any different, doesn't make the study design and construction, and it doesn't necessarily change any of that. The research can be just as rigorous. So that's what
Nor
seems...
the safety oversight. The safety
Right.
oversight is the same no matter what. So it doesn't matter what funding source that something comes from. These institutional review boards and monitoring boards monitor the same regardless. So that's, I think, an important point. Yeah.
Yeah. So it seems like a huge oversight, or just maybe even just misunderstanding on the point of the health board to shut this study down, and such a blow to innovation for schizophrenia research. And so do you have any other options on how to maybe alter the study or do it somewhere else, or try and get federal funding, although it doesn't sound like that would even work? So what other options do you have
Yeah.
at this point?
Yeah, I mean, this is new information as of the last week, and so I think our first steps are really trying to put together, an argument or information that would help maybe override this decision. I'm hopeful that maybe with discussions and more information and people stepping forward too about the importance of private funding, that it'll help educate everyone involved with our scenario. So I'm really hoping and do have an optimistic view that the science will prevail, and I think that that's in the truth, and the science sort of prevails. Will be an important day for all of us, for science, especially our patients who really could use other opportunities and other options besides. I mean, that many of them have failed, or not. They have failed. Like, our medications have failed them. Like, we have failed our patients as a field, and that's, I think, the story about treatment resistance that's important. I think that there are lots of other steps. I mean, we have run across problems before in research. Research is tough. It's rigorous. There's so many people to satisfy and so many monitoring boards, and we have, and funding sources have come and gone. We have, we've been able to get through of what the science is important. We'll be able to figure things out. I'm not sure how we move forward with this inpatient study because we only have it as an inpatient study designed to be in a setting that's rigorous right now in terms of a controlled environment where the diets are given. But I'm currently, trying to figure out other ways that we can move forward with this and talking to others. Hopefully next time if I talk to you, we'll have something figured out. But as of right now, the research is currently shut down as it stands. So,
And such a crime because just like you said, we failed these patients. And so the real loser in this scenario is the patients. They are the ones missing out and really being really suffering because of this decision, which I hope the health board realizes that their decision is just harming patients rather than doing anything else. And maybe that will wake them up to saying, oh yeah, it's about the patient. It's not about us. And this
yeah,
research is going to help patients. So
it's definitely about the patients for
yeah,
sure.
yeah. Well,
Yeah.
I'm so sorry you've had to go through all this, but thank you for all your advocacy and your research and all your work. And hopefully just messages like this, people hearing this and people talking about it, and the Baltimore Sun article, and letters of complaint and hoping to try and reverse this. Hopefully there'll be enough groundswell for the health board to sort of wake up and be like, oh yeah, we overstepped and we should undo this.
Yeah,
So
no, I
fingers crossed.
appreciate it. And I do hope so. I was hoping to talk to you about a study that's ongoing and how exciting it is to keep moving forward. But I still will continue to have hope that we could make some ground here. And I appreciate your time and listening to this. And I think it's really exciting that we do have this opportunity. We've had this opportunity to do an inpatient study. And I think that the field knows how important this will be. So, like, fingers crossed that we can all do this together. So thank you so much.